I get a lot of clients who come for injury management and pain management. As a therapist, I treat them and I advise them for rehabilitation post-treatment. And the success rate of getting a client compliance to attending the rehabilitation session is 50-50, because most of the people are not aware what happens if you don't rehab after the treatment. See, after the treatment is done, say for example, a person has got a muscular injury and he has attended 6 to 10 sessions of treatment, and after which the pain substitutes or reduces considerably, after which they think that the pain is totally gone, right? Even though if there is 100% of reduction in pain, there is no restricted movement and there are no restricted range of motion or reduced range of motion, or there are no any other specific symptoms, yet they have to undergo the rehabilitation process. Do you know why? Let me explain you. The muscle goes for injury because the person has placed an increased demand on that particular group of muscle or a single muscle, all right? And that's why the inefficiency of the muscle has put the muscle onto a dreadful stage of injury, all right? So when we treat by manual methods or by any other traditional physiotherapeutical methods, what happens is the injury heals. After the healing of injury, the muscle has a tendency, it's a physiological principles, we call it. One among the 8 physiological principles is called as the reversibility. All right. So this reversibility plays a very vital role in rehabilitating, all right, and the injury process. So let me put this in a different way. When you don't use a particular muscle, or when you don't activate or use a particular group of muscle for consecutive 2 weeks, what happens is it will lose its strength and it will start degrading its own power, all right? So basically, if you want to increase your muscle, it takes at least 4 weeks to 6 weeks, or improve the power, it takes 4 weeks to 6 weeks. We call that as general adaptation syndrome, all right? But when you don't use the muscle continually or consecutively for that 2 weeks, that is 14 days, you go back to the same position where you started, all right? So this is in regular terms, we call that as detraining, all right? So this reversibility is nothing but detraining. And this predominantly happens during the injury process. When a person or a muscle group is injured, what happens is there will be reduced range of motion or activity involving that particular muscle, right? It can be, say for example, 10 sessions. It can be on daily basis or on alternate days. If it is on daily basis, it's almost 2 weeks, and you have not moved your muscles or you have restricted our activity for the past 2 weeks. So what happens is the reversibility principle applies there, which will push your muscle to the weakest level, all right? And hence, you have to make sure that you get back the strength that you have lost by rehabilitating your muscles or exercising, performing basic rehabilitation exercise to get back to the original strength. What happens if you don't rehab is your pain will reduce considerably, or 100% recovery of pain will be there. But after 6 months or a year, definitely you'll get back the pain again. And this time, the injury will be more worse compared to the previous session or previous level of injury, because you have taken the muscle for granted. If you do not want the injury to reoccur on its own, you have to make sure that you perform the rehab 100% without any deficit. If you don't do the rehab, chances of re-injuring is more higher compared to anything else. Even if you don't do the activity, or even if you don't push your limits, you tend to strain your muscle. Most of the people who visit for therapy, for physiotherapy, due to low back pain, or due to upper back pain, or due to neck pain, most of them get the injury or get the pain due to their work related posture. All right, not because they played a sport and have got an injury. That's totally a different concept, and that's totally a different context. All right, so when a person, just by sitting ideally and working on a desktop or a system or a laptop, if he or she strains the muscle, then it is high time that you treat the pain, you get rid of the pain, and then you rehabilitate yourself. If you don't rehabilitate, then chances of getting the strain or the injury or the reoccurrence of the injury will be for sure. And this is Dr. Vasan for Fitness Inc.